Hi, I'm Duncan here at the White House Dental Clinic in Farnham. And if you're watching this, it's almost certainly because you've been asked by either myself, my colleague Grieg, or one of our hygienists to arrange an appointment for a periodontal pocket chart. So today we're going to talk about periodontal pocketing. Periodontal pocketing might have been mentioned by your dentist, might have been mentioned by your hygienist. It's a huge subject. It takes a lot of explaining, but it's very important that we do talk about it. If your gums are in perfect condition, the dentist or the hygienist shouldn't be able to probe beneath the gum line more than 3 millimeters. 1 to 3 millimeters is what we call a healthy pocket. A healthy pocket becomes a disease pocket when you've probably not been cleaning sufficiently between the teeth, the so-called interdental area, with floss or those little teepee brushes. And what's happened is a collection of bacteria will have built up around and between the tooth and the gum and has begun to migrate apically or down towards the root of the tooth. Whether a pocket is healthy or not is identified at your hygienist appointment. The hygienist goes around with a probe marked off in millimeter divisions and gently walks this probe all around each tooth, marking it in 6 different places. Now this will gauge whether the pocket is healthy. If it's more than 3 millimeters deep, then it's classed as non-healthy. If you've got pockets deeper than 3 millimeters, there's now nothing at home you have that can get to the base of the pocket. And because you can't clean to the base of the pocket at home, a little bit more intervention is needed via the hygienist. It may be that you only have 1 or 2 deep pockets, and this is called a localized problem, or the problem may be more generalized with multiple areas of deep pocketing. These areas can be measured and recorded on a device with some software called the Florida probe. Now this is a way of mapping and monitoring these areas. All this information is digitally recorded in the patient's chart for future reference. When the pocket depth is deeper than 3 millimeters, there is a mass of bacteria. These bacteria will flourish and they've got their own sort of ecosystem. And as the bacteria die, they produce toxins, and it's these toxins which will cause pocket depth to carry on getting deeper and deeper. If you have a pocket for a long time, the surrounding gum may be a little bit inflamed, you may even have a bit of pus, and also a bad taste in the mouth. But sometimes it can be quite pain-free. Another thing the dentist may do is take what's called a panaural X-ray or radiograph. Now this is essentially a sort of all-round scanning X-ray that's more designed to look at the roots of the teeth and the surrounding bone. And this is because the bone supporting the teeth could also become affected, not infected, but affected. And the bone levels may have been reduced. In other words, the bone has dropped. And if nothing is done, bone levels will continue to drop and the teeth will become more and more mobile or loose. Once the initial course of treatment is finished, it's absolutely paramount that everything you've been shown by the hygienist, you must do at home. It has to be done on a daily basis. If you have to remove all the plaque from every surface of every single tooth every day, because otherwise the condition will come back, and sometimes very, very quickly. There will be times when it'll be quite an active disease and times when it's a little bit more dormant, but it will recur if you don't do your homework. The hygienist will continue monitoring, in the first instance probably every 3 months, just to make sure that the disease is under control. The pocket chart will be redone to make sure that the pocket depths are reducing, and then over time you may be able to go back to normal 6-monthly appointments. But it is a lifetime commitment. It's something you'll have to do forever, because periodontal disease, the one thing we know about periodontal disease is it cannot be cured as such, but it can certainly be kept under control by putting in the effort. So here we have an example of how a Florida probe chart looks. It records everything from bleeding. So here we have sites with bleeding. It shows all the areas with plaque. That's the little purple dots. It records areas of gum recession, like here, and all pocket measurements. They're the red and the yellow bars. A healthy pocket, as we've said, is between 1 and 3 millimeters. A deeper one would be 4 and upwards. Sometimes they can be as much as 9 or 10 millimeters, such as here, which of course is quite serious. When your gum condition is monitored at your 3-monthly appointment, the chart can be redone so the hygienist can refer back to your so-called base chart, where the initial set of measurements were taken at the first appointment. This, of course, is a very useful comparison to see how the pocket depths are improving. And obviously the whole point of doing this is to make sure that the depths do improve. And then hopefully areas like the forge, in theory, should be able to go back to being completely healthy pockets. The 8s obviously will take a little bit longer and may never get back to 3, but you should still be able to reduce their depth. So it's a really good point of reference to be able to come back to at regular intervals with your hygiene maintenance appointments. The great thing is you're given your own chart to take away so you can see the areas of concern yourself, the areas in the mouth which require that extra bit of attention. And actually we found it's a great incentive being able to see if your 4 or 5s have reduced to a 3 millimeter pocket at your next appointment. So like I said at the beginning, it's a huge subject, it is complicated, but it's a very important subject. And hopefully this will go some way to explaining why we sometimes need what seem like incredibly confusing measurements from your gums. But it's all in a very good cause, and the whole purpose of this is to help you keep hold of your teeth longer. After all, none of us wants to lose any of our teeth. So thank you very much indeed. Thank you.